Thank you all for coming today, and thank you for what you do in your community. I'm Jack Murphy, and I'm the chair of the North Fulton Improvement Network, which is about a 7 or 8 year old organization. Used to be called the North Fulton Poverty Task Force. We pivoted away from poverty, realizing that financial vulnerability is a much broader problem in in North Fulton, and that's the area we look at. We're a group of nonprofits, businesses, faith leaders, and a growing number of politicians that are trying to solve the challenges of financial vulnerability, and by studying 5 different areas: income, transportation, food insecurity, child well-being, and of course, in the areas that we're talking about today, employment. So we thank you all for joining. I have a slide presentation that I will share. And with that, this income and employment work group meets the first Tuesday of every month by Zoom. So if you are interested in this and you're not getting the invitations, please let me know, and we will get you those invitations. So at this point, I would like to introduce Dr. Ward-Robinson.
Thank you. It is a real pleasure to be here. Good morning, everyone. Thank you for the opportunity. And Jack, thank you for the privilege to be here. We worked together under the old label just before COVID, 2 years ago already. That was a very successful event. It is a real honor and privilege to serve in the community where I live. And I want to just make a couple of key points, and then I'm going to introduce our speakers because they're the ones that you came to hear. 60,000 families in North Fulton are considered financially vulnerable. And at least that's what we knew before the pandemic. However, I am sure with the pandemic's presence that number has changed considerably. And those families include not only residents, but those that come into the area for work. And the overwhelming majority are of people who are seeking aid from charitable organizations are people who are actually employed. And in North Fulton, where we have the blessings of businesses and thriving economy, it becomes challenging to understand not only how the issues that Jack talked about, income, transportation, food insecurity, child well-being, employment, threatens workforce procurement, but then workforce sustainability, and actually impact the quality of life then that is given, the quality of service that's given to the community. So I'd like to introduce our speakers because they're going to be able to talk to us about not only the issue of staffing, but at some point, I'm sure we will talk about how these factors come into play as they try to recruit, retain staff, and deliver the excellent service for which they're known in the area. And I believe that we will have Jon-Paul first. Yes, thank you. There is this young man has a very long and impressive resume, so I'm not going to read all of that to you. But what I will say is that he's the president of WellStar North Fulton Hospital. He oversees one of Georgia's only level 2 trauma center, delivering cardiovascular services, women's services, pain and spine center, wound care, hyperbarics, and inpatient rehab. It is North Fulton's primary stroke center and an accredited chest pain center. And most recently, Jon-Paul's team developed and opened one of Georgia's only comprehensive stroke center. John, I'd like to invite you to take the stage and give us a little bit of an overview of your comments relative to these topics. Thank you.
Great. Thank you, Dr. Ward-Robinson. And I really appreciate being called young. That is the first time I've gotten that in a few years, and that is awesome. So I feel much more youthful, and I'm going to have a much better presentation, I believe now. I just wanted to say first, my name is Jon-Paul Croom. I've been here for about 4 years now at WellStar North Fulton Hospital. We have as was mentioned, we have a very acute network of physicians and services here. One of the things I will mention today is because of the services that are demanded by our community, we have to search for the very best individuals who can fill those roles. We have services which include a level 2 trauma center. One of the only ones between Atlanta and Northeast Georgia. We also have, as was mentioned recently, have begun doing comprehensive stroke services, and we have long worked with patients coming in with cardiac services, having heart attacks. These services are important in a community, and many communities don't have these services. And we work very hard to find the right people that can work in those areas. Some of the things I'll be talking about today is from an employment structure. We have over 1,000 employees at our hospital. We work obviously 24/7 shifts. So holidays, weekends, we are always open. We have these 1,000 employees represent over 30 distinct professions, all different levels of education and background. But every one of them is needed to make this engine work. They live throughout not only the Atlanta metro area, but also throughout North Georgia. We have some employees that travel almost 2 hours to come into work. And that's not unusual for hospitals in our areas, depending on the type of job. We are, we are excited to have this discussion. I think that employment and retaining employees and finding the right balance between finding employees that are able to live and work locally is important, and I hope that we can have that discussion today, because we have many, as I said, that travel long distances to get here, and I really appreciate the opportunity to have this discussion today. Thank you.
Thank you very much. And now I'd like to invite to the stage Beth Cayce. And equally as impressive with your resume, Beth, you have more than 43 years of leadership, rehabilitation, and health management services in a variety of senior living and healthcare settings in this North Fulton area. They include North Fulton Hospital, Piedmont Hospital, Northside Hospital, Wesley Woods, and Community Home Health in Atlanta. You also bring a national acumen of experience in your career, where you were Senior Vice President and President of a long-term senior care division that operates over 3,300 centers across 10 states. You currently serve in the community, so you are right here. I think Jack gets people to do everything he wants them to do. He just asks, and we all fall in line. And so you two are in that community. And I'd like to hear from you, your perspectives on the issues we're talking about, today. And then after this, we're going to invite some questions from the audience. I too will have some questions for you, and we'll try and get to the heart of some of the challenges that you face, not only in recruiting and retention, but addressing the needs and delivering excellent service. Beth, please take the mic.
Thank you, Dr. Robertson, and thank Jack and Nancy for inviting me. What I wanted to do was quickly just give you an overview of what I do on a daily basis. I did have a national presence, and I made a decision in 1998 that I wanted to come back and give to this community the ability to allow seniors to age in place in their homes, wherever that might be. And so since 1998, we've served over 20,000 seniors in Roswell and the metro area, but primarily in North Fulton. Our company provides home care to people in their homes. We provide services to people in senior living, particularly in dementia care, and in independent living where people may need some medication assistance. We also manage assisted livings and consult with assisted livings. I think this is of particular importance to me because many times you stand on your laurels, and we've been an employer of choice for many, many years. But I think in the last year or two, and in particular related to the pandemic, we have been more challenged with recruiting, which we knew was already difficult for the workforce, which I'll talk about in a moment, but has become even more difficult as the pandemic has gone forward. From a company, we have about a 40% turnover in our staff in an industry that has about 80% in caregiving right now. 79% of our staff, however, they'll have been with us over 1 year, and 60% over 2 years. One of the things that I want to point out to the audience, just as an overview or kind of to set the stage, is that in the next 2 decades, there'll be a 30% in North Fulton of population that's over 65. And then also in North Fulton, the number of people that'll be over 75 is going to triple by the year 2050, or that's a 12% increase. Another startling statistic, and this will come up as we talk about that, is that 75% of Americans over 65 that actually will live with multiple chronic conditions. And I'm sure, as Jon-Paul has recognized, many of those people during the pandemic did not access medical care and actually began to have health declines. We know about 15% of those people that are working right now are caring for an older adult, and 1 in 5 people over the age of 50 are crunched between caring for both aging parents and their own children. And this growth has a direct impact on the largest group that will serve, and that's home care services workers, or certified CNAs, personal care assistants. Also, where the job crunch comes in is that the certified nursing assistants job growth will be over 9%, almost twice the national average of all jobs. And that's directly impacted by the aging population. We know that it's vitally important to ensure that we have resources in our community to enable older adults to continue leading healthy and independent lives, which is why I started my company. One of the things I'd just like to point out, and then I'll kind of be quiet, is kind of a pre-pandemic current analysis on workforce that we have. And one of the things that we've seen significantly is that pre-pandemic, we would typically, in order to yield 9 hires a month, have 119 applications. And since the pandemic has occurred, it has taken us on average toward the end of the year, almost 990 applications to yield 7 hired workers a month. It's almost 9 times the effort. And we'll talk about a lot of those reasons. Many of them have to do with a lot of new senior living providers coming online to meet the needs. And that means we have a greater need, for workers in this North Fulton area. A lot of it has to do with people having a fear of the pandemic. I lost 40 employees in less than a week or two as soon as this pandemic hit. And it wasn't just all because people were afraid. It's because they had to take care of family needs, because they had an elderly person they needed to care for that may be sick. They had children that they had online school. They had travel cost needs, many, many needs, which we'll detail in the conversation, particularly a lot of lifestyle demands, which also play into factor with the workforce. But I think it is significant to say it is much more difficult to hire. It takes a lot more work, and some of the things that we need to do have to do with actually growing our own workforce. So with that, I'll kind of turn it back over to you, Dr. Robinson.
Thank you very much. Boy, both of you have brought some startling statistics to the table for consideration. Some of them I imagine, and some of them I recognize. What is interesting is the challenge that both of you have for employment recruitment, but yet the scale and the challenges associated are pretty startling. So I'm going to ask Jon-Paul first to reflect on this, and I imagine the question will be very relevant to you as well, Beth. Given that the employees you have are generally commuting long distances, and Beth, you noted that lifestyle changes, transportation is also implicated in the loss related to the pandemic. How do you, what are your thoughts around ameliorating that? What are your thoughts around trying to get a handle on that? Because what that reveals to me is that the recruitment is not occurring locally. And so how do you manage those two and better plan to ameliorate the burden that comes with commuting staff and staff that even if they're at the job, they're pulled because of what's back at home and the demands that they left? Jon-Paul, would you like to comment on that?
Yes, absolutely. The distance that people that I do want to mention first, and the burden of COVID has certainly been high, but we have had this issue with commute time long before COVID. As I mentioned earlier, one of the difficult things about where we're positioned in North Fulton, I'll say the good first. I mean, I think we all appreciate it's a great place to live and work and play. But the challenge for some of our employees, especially those that are the lowest paid employees, it's very difficult for them to find a place to live close by. And because of that, and I'll give housekeeping as an example. In the hospital industry, we call it environmental services. So for environmental service workers, we recruit, and we do try to recruit locally, but we're somewhat limited in the number of people that live locally that work in those jobs. So what we see is a very high percentage of our environmental service workers travel all the way up from Atlanta, and they're working 3 shifts during the day. Many of them will take the MARTA transport up and then get off at the stop on 400 and then transfer to a bus, and then the bus will take its route up here. And so a lot of the issue that we see is that we have workers that will spend an hour and a half or more just in transportation every day. And before the pandemic, this was already a problem. And what we would see is that if you're coming up here and you have this job, if you find a job closer to your home in Atlanta, you're going to go to that job, even if they pay you a little less money, because you're going to get 3 hours of your life back every day. So what we've had to do is continue to increase the rates, and I think that's important. But the other piece is as a community, I think it's very important to continue and move along this discussion about affordable housing near the places where people work, because the hospital, we're not the only group that hires many employees that need affordable housing. I'll say the pandemic has made this especially hard because now we're in a situation where not just with environmental services workers, but all workers, the biggest issue for us, which is probably the same with many employers, is that most of our children are in public schools, and when public schools decide to go to not be in person, for many good reasons, it puts a very big burden on those households with single mothers or two parents at home working, and suddenly somebody that's traveling a long distance can't leave a young child at home to be virtual by themselves and are having to call out work. And as this is happening, at the same time, we're seeing surging COVID rates at the hospital where we need more help and more workers.
Right.
And so we have fewer people that can come in because they're dealing with, school responses and taking care of children. We're, on the other hand, we need more hours. So we're driving up overtime on the workers that can come in. And this just cuts across all levels. And, there's been, it's been tough, and there's, and burnout is a real thing. But those two things are difficult. And even for those that don't commute all the way up from Atlanta, I mean, we still have, nurses who may have difficult time finding, a place to live close to the hospital. And we're a very competitive industry. I think nursing in general, and I'm sure Beth will tell you too, it's, the demand keeps going up for nurses, for certified nursing assistants. There's so many opportunities within just our Atlanta metro area that it is, there are just not enough people to fill the roles. And this is even before the pandemic. The pandemic has just made it even more difficult.
And Beth, would you care to comment on that? Because I imagine that you particularly experience these same challenge or challenges equally, where you've got workers with family demands. You mentioned lifestyle. How do you manage that? What do you cope, and how do you, what's the plan then to deliver the good service to the communities here that are expecting it, that are continuing to age?
I mean, it's a difficult challenge. I say every morning I get up and pray. I start the day with prayer, Lord, cover this and cover our workers. But the reality is that we have to be a lot more flexible. We've got most of our workforce is certified nursing assistants, and most of them do not have reliable transportation. Even if they do have a car, the ability to have that car on the road and continue to break down, that's a challenge. So we've had to look at Uber rides. We've had to look at car sharing. We actually even provided one of our caregivers who would fill in at any notice a car. We've had to think outside the box. The other challenge we have is that most of our care is not delivered in a downtown setting, like in a downtown Roswell or Sandy Springs. It's out in the suburbs. Well, the bus lines aren't there. And so I really have had to start working with the people we provide services and say, I know you would like us to be there right at 8 o'clock, and we would too. But we have to have some flexibility because you only want 4 hours of care, and I've got to pair this up, because if I can't have the worker at least be in a vicinity for, at least 8 hours, sometimes 12, they're going to pick a job closer to home, and you love this caregiver. So there has to be a lot more dialogue, in regards to that. And they actually have to see that it's not only us that can't provide it, but it's other providers as well, because we're all limited. In fact, it got so difficult in the pandemic toward December that we had multiple in-home care services where we all had to band together and basically work together to fill shifts, because no one of us could, because of flexibility that was being demanded at that time and on the workforce. So it is definitely a situation, but I really tried to promote as much as we can online education, so we don't have to bring people in for training, online recruitment. We tried to pair jobs. We tried to look at car options. And I'll talk a little bit later about employee-based training, where we can train more of our own and we don't have to train in nursing homes, which then I lose them to nursing homes, and nursing homes are needed, but I also need that staff as well. But I'm a big proponent of looking at some type of tax credit that will address transportation or the leasing of cars or the sharing, whatever. We need to do more, because transportation is a very limiting factor for us.
So it sounds to me a couple of things emerge across both of you. One, housing, because then, you know, if there were affordable housing, people could live closer in proximity, you know, however that gets framed. But then also transportation, and these will exist post-COVID or at COVID-25. These will still be issues that we have to deal with. And it sounds like there's a need for a larger conversation, because as employers, you are doing everything you can, and you are recruiting and retaining. And Beth, you are going way above and beyond to get this, to keep your employees and to recruit. I hear but the credits that you've talked about, is that something that WellStar would stand behind and would want to help champion in partnership then with the North Fulton community? I keep saying task force, Jack, because that has stuck in my head, and that was my brand coming into the group. But with this community and others, I think you'll find about that.
Oh yes, absolutely. Yeah, it's something that, you know, not only are we prepared to this, you know, I think the thing about healthcare, and I speak of both hospital and home care, is that a lot of people that I know that are not, you know, in this industry, they don't understand. You don't understand the need for it until you need it. So, you know, for instance, my parents are now in their 70s, and Dad's 81. They moved into a senior living facility in Sandy Springs. And even having been in this industry for years, I didn't fully understand the need for certified nursing assistants for my dad, and how difficult it is to get people there. And you know, and I think, as Beth said, just you find somebody that you like, but it's hard because people are going to find that job where they can work more hours, that they can work closer to home. And as our population here ages, and as more, you know, as we get older and we keep ourselves alive longer, we end up with more comorbidities. We need more trips to the doctor and our specialist and to the doctor, and having you know, caregivers come to our homes. And that is it is a rising challenge. And those two things, transportation and affordable housing, are very important. And if we pride ourselves as a great place to retire and age, it's important that we have all of those services, which include those people that are going to help take care of us.
Thank you. Beth, would you, you know, what is your position on that?
I mean, I think there has to be a lot of public dialogue. I mean, I think what happens with if we know that 15% of the workforce is having to care for their older adult, that impacts their ability to provide. if we know that we've got this growing population, and one of the things that's happened with Metro Atlanta is a great place to live, but it's also a great place to recruit your parents to come live.
Yeah.
But with that comes the challenge of, if you're going to allow people to remain as independent as possible in their home or senior living, you've got to have a workforce. So you have to address, they don't just magically come out of the air. This is a huge growth industry. We have to address, how do we have some affordable housing here, or we will not be aging in place here, or more people have to leave their jobs and care for their parents. I don't think there is as much awareness. Everyone hears this as tsunami, but I will tell you from interviewing so many families, they really don't understand that you don't just have a caregiver at a dime. You can't just call up and say, and Jon-Paul, we have this happen a lot. Someone's coming in from the hospital, we're gonna call in 2 hours, we need somebody right now. I'm like, well, good luck. I don't say that, but you need to be aware that planning needs to occur. So one of the big things I really try to promote is talking with families about making a plan and having some flexibility. But also I throw in there always, if we had some affordable housing, it would help. People don't like to hear that, but they need to hear that. If we want a vibrant community where people can age in place, multi-generational, we have to have affordable housing, and we have to have some solutions for transportation. It's important to our long-term survival, I think, as the type of generational care that we want to give.
And that brings me to thinking about the recipients of the care. And, Beth, you mentioned the failure to plan for caring, the limitations around thoughtful planning when you recruit your parents. And I represent that. My son was here, and it was because of him that I am here in Roswell. So I absolutely get it. I get what you're talking about. But what does that conversation look like with the community? Because there's an assumption then that I'm here in this community and the service through incentives cost shift then, and their costs that then may be shifted to the recipient, the person utilizing the care. We need to your tax contribution base to support housing. You need to pay more for your services. We need to address metro and transportation. What does that conversation look like, Beth, to really raise awareness and have people understand the interdependent nature of these issues?
I mean, it's a complex conversation. I mean, I'm going to use the example of when people want to walk around communities, or in Roswell, we wanted a bike community. We just kind of put that out. That was the persona that we wanted. I think the conversation has to be, if you want to be able to have a community where your mother and father and you live, then we have to all be supportive of what that workforce looks like. It's not just, we're just building these low income housing, but what is the community we want to build, and what does it need to have with it? And what flexibilities need to occur there? And are there some volunteer agencies that even want to work on some transportation out to suburbs for people? What is it we want to do for that workforce, in terms of some special benefits that they could receive since they're traveling? One of the things we tried to do was have a conversation with the local church. Could you have meals? So these people don't have to even go home and cook. They could pick up their food and they could take it home. It's a community-wide conversation, and it's not a one-time conversation. It's a continual thread of a conversation about what we need to do as a community to take care of our needs. And I think with that, it benefits, because one of the things that I do think, and I'm going to just say this, a lot of times certified nursing assistants are not seen as professionals, and they are. They're not sitters. And with the amount of care that we need, they provide very important care. Recognizing them as professionals and wanting them to be part of the community, I think is a whole nother discussion that's important. Trying to work on recruiting people that perhaps because of the pandemic have lost their job, having more employer-based programs where we could get some funding for that, because our average workforce is over 40. That tells you something there. Where the average CNA is 25 to 35, that's a person that's on a path, which is a good path to be a certified nursing assistant, but they're on a path also to be a nurse. I need to retain people who want to continue to be certified nursing assistants. So having a conversation in the community, what can we do to support employer-based training programs? And there's a few things we can tweak down at the Capitol and some of our laws to do that, but I think it's possible. So it's a regular, continual conversation.
I really appreciate that. You've made several great points there. I love the idea of the holistic model. And John, I'm going to pivot back to you. And you began by having this conversation with a focus on the environmental service community, the housekeeping staff. Do you see the same sorts of issues at other levels of your organizational structure as well?
Yeah, I mean, we have the same issue with our certified nursing assistants as well. You know, food and nutrition services can be a challenge sometimes, but you know, if I were to talk about our largest part of our workforce, which is nursing, we have different challenges with nursing. I think the issue before the pandemic, we all know there weren't enough nurses or not enough people, you know, going into nursing, not enough nursing programs. You know, one of the things that we've worked hard on at WellStar is partnering with schools, such as, you know, locally we partnered with, you know, Gwinnett Tech over in Marietta. WellStar partners with Kennesaw State. There's other partnerships with Georgia State too, and Mercer University, to help fund and create and staff programs for nursing. And so there's a big drive to try to get more people to choose nursing as a first career or second career. And you know, part of the issue with our certified nursing assistants, Beth is right. You know, we're kind of on that other end saying, yes, we need CNAs, but we also need nurses. So what kind of bridge programs can we come up with to help CNAs make them nurses? You know, so, yeah. So, so it's you know, but there's just not enough people going into healthcare. And here's the other reality about healthcare. It is a hard physical and intellectual job. Yeah, you have to be smart, but it's physically hard. I mean, to be a CNA or to be a nurse, you're on your feet all day, a lot of times 12-hour shifts, and doing a lot of hard physical labor. And it's tough. You know, a lot of young people come out of school with this idea that, you know, this is what I want to be. And it's a tough job. So what we even see within nursing is there's a shift. Okay, you know, you come in and you work on our medical surgical unit, but they start saying, oh, well, I really want to go work in the cath lab because it's a less physically demanding job. And you know, there's a lot of movement through the nursing process as well. We have a big challenge also with nursing salaries. There has long been a drive within Atlanta and among the Atlanta hospitals to keep driving those salaries, because again, there's not enough nurses. What we've seen with the pandemic and what has really hurt all of us is that there are places in the country who had much worse COVID rates than we did and started paying these agency rates that are as high as $160 an hour yes, absolutely.
Wow.
For nurses.
Wow.
And
Wow.
and we've seen locally as high as $120 an hour. And so
Wow.
agency in the past was used to you would just fill blocks. So you'd
Yes.
say, okay, in the winter we're hitting a surge, I need more nurses, not enough live here, so I'm going to get agency to come in from out of state and work these shifts for 13 weeks.
Wow.
But now it's you know, we're in a surge, we don't have enough nurses. A lot of our nurses have left to go work agency somewhere else. Now we have to hire agency to bring them back. And they're, for the first time, I think we're seeing a lot of nurses that live in Atlanta that are working agency in Atlanta. So it's something that it's not sustainable. It's kind of happened during this pandemic, but but it's made it very difficult, on on everybody, because we have an unsustainable rate, and again, not enough team members to do what we need to do.
So that's it's almost a conundrum, because we started the conversation from the idea of not being able to afford to live here, and people are commuting in to work, but looking for work in their local community, even if it is less. But then at a different category of the employee, because the demand is so high and lucrative that there's no need then to come to this area. So you have to almost create your own pool within the area. And you mentioned about unique relationships you have with the university. So, I mean, one critical takeaway I'm hearing already is the need for that public dialogue. But it sounds to me, and Beth, a part B to that is really thinking about how you engage other resources in the community to fill in some of the gaps and help to bridge and create a holistic model of care. But I'm thinking now about training that allows for sustainable performance, and maybe even pipeline and gateway programs from CNA to nursing, or from one area of the hospital to another area hospital. Are these conversations you're having with you mentioned Mercer and Georgia State University, but is the conversation to fill or to recruit at the moment graduating class, or to create a pipeline program that really begins to early as possible, even high school, begin that exposure that drives all the way through, and perhaps even allow people to stay then in the area?
It's that second piece. It's to be part of creating that pipeline, creating more opportunity for more slots within these schools, and helping fund those, or providing nurse leaders to help do clinicals on site.
Right.
And this is both for nursing and for CNAs. And I think the other point you just mentioned that made me think is that we have a huge opportunity in this. I serve on Gwinnett Tech's foundation board as well. Is not only do they do a lot of work on getting people started in nursing, but they do a lot of work on the CNA side too. But there are a lot of individuals in high schools that and I know this is kind of an American thing, that we all need to go to college, but I think a lot of times we don't think about the technical schools, and there are a lot of opportunities in our high schools right here in North Fulton for somebody to start, in their junior and senior year, to start getting experience, and go into a place like, Gwinnett Tech's Alpharetta campus, and bridging that so that by the time they graduate, they can be working in an industry, and if they want to be a CNA for a while and bridge it later, or not. I mean, I think we have a big opportunity to connect better with our high schools, because we have a lot of young people coming out that could serve in some of these areas.
What would that entry salary look like, John? Any idea?
I'd have to. I don't have the CNA salary right off the top of my head. It's probably about the same as what Beth has.
Yeah, our entry CNA is $12 an hour.
Yeah.
Okay.
And the range would go on up toward 15. Special cases that we do specialty training on might get as high as 18. So, but around 12.
Mm-hmm, mm-hmm. Yeah, because one of the things we're hearing is, especially in the pandemic world we're in right now, lots of students, a big issue is students not necessarily continuing in high school, not necessarily breaking for the university, but breaking for employment to help families right now. So I want to encourage the audience to submit your questions because this is so intriguing and so exciting, and I have tons of questions based on everything you've said. But one other question I have is the issue of cost of the service then, and how that gets matched against your cost of operations and all the things you're doing. What does that conversation look like then to those of us who idealize living in this area and do not have a good sense of what that cost is, but calls on demand, and not recognize then that the demand can't be filled because your employees are coming from Atlanta and there needs to be a plan? How do you keep costs down, pay employees, operate, and still deliver and remain the employer of choice?
Well, that's a challenge. I mean, typically we don't do annual cost increases because we know that to have someone, particularly if they're going to work 8 hours or greater or live in someone's home, the cost is expensive to a family, and it's not covered by Medicare. Okay, it's either long-term care insurance or they're personally having to pay. So that's a challenge. So we really had to walk a hard line. We had our first price increase in 2 years this year, and all of that went to increase the starting rate of our CNAs. Okay, our average CNA, not on a starting, probably makes about $13.50. Okay, so in order, and they go up from there, from 15 and higher. In order to do that, we had to take our pricing up, and I was scared to death to do it. I have to tell you, absolutely scared. You know, I didn't have a single person push back, not a single person. I was absolutely shocked. You want to know why? Because they need this service. So I think there is a recognition of the need. I would tell you that there is, but I do know there are people that can't afford it, and what subsidies can we afford them? I know Senior Services North Fulton does a great job. We are a vendor for them, you know, with helping with small cases. But when it gets to be larger, really our only two resources are try to work with respite groups we work with that have some funding that can help. But it's a challenge, and not everybody can afford it. And we are constantly walking that line in terms of what can we do. We've even gotten to the point where we've had discussion. You want to share a caregiver? Would y'all like to share someone, which would make it a little bit better in terms of pairing up? But I do want to comment on one additional thing, backing on what Jon-Paul said, back on the employee training issue. I would like to add this. He has the ability, because he's a hospital, to have the certified nursing assistant practicums occur in the hospital. As a home care provider, we don't have that. And that's something we've gone to our legislator to ask for. Used to be that most of the certified nursing assistants were in nursing homes and they were in hospitals. But as this field has grown and aging and people want to keep people at home and in the continuum, there is a need for employer-based programs. And this is where working with the high schools and the VOTECs are so important, to have the students trained, to have the practicums occur actually in our setting, so we're able to attract people, even if it's only for a short term because they're going on for additional career. That's really important. That's a passionate agenda I have, is to get that to happen so I can have a greater workforce training.
I think that is very important. And again, it speaks to, and it really underscores the need for that broader public dialogue, because I think that just fundamental living in this area probably reaches somewhere between $20 and $25 an hour, which therefore then requires almost doubling where you are in some cases to then attract the kind of people retain, and perhaps you don't start at that, but if you've got that pipeline and gateway pathway, then you can, because I imagine people enter the healthcare field. I know I certainly did, because of a love and passion for caring for others. You do volunteer work because of this. But for young people, there needs to be a gateway if they're going to have a family, if they're going to have an opportunity as well to then support their family, and particularly if they're in the sandwich community. So I have a question from the audience that I'd like to share. And someone wrote, what do you think it will take for people choosing these more direct service positions like CNA and environmental services as their career, and not necessarily moving on to using it as a stepping stone? What do you think it will take to keep people in those careers, in those areas of work? John?
Yeah, that's a hard question. I think it, and this is not a great answer, but it really depends on, where someone is in their career and what their, aspirations are in life and what their family situation is and where they live. There are a lot of different reasons. I think that the CNAs that we have that have been here for a long time, 20 years or more, these are individuals that they love the job that they do. They love the people with whom they work. I think it is, important for all of us as employers to make, the job experience and the feeling of belonging and family important. And, I think that is a big piece. The individuals that there will always be groups that want to keep moving up, and I think that's great too. We just have to be able to balance between the recognition that there are always people that are going to be moving through these positions. There's going to be a certain percentage that stay in the positions, but we always have to be thinking about on the front side, that pipeline to keep refilling. And it's something that when we recruit and hire, it's not just a snapshot in time. It's a process that we all must think about over the next year, next 10 years, next 20 years, on how we continue to grow and build this group of employees. Because I say this all the time in the hospital, we have so many different positions, and I use housekeeping a lot. I said, every position is so important. If one day housekeeping doesn't show up, we shut down. I mean, it would not work. Everything would grind to a halt. And it's so important that, we encourage and create a system of respect for all positions, regardless of background and education and salary. It's important that everyone feel that they're part of a great place to work, and that's something I think we should all do.
I am very mindful of time, and I want to squeeze in, Jack. One has to do with, would Metro, extending Metro, would that make a difference? Either of you, Beth?
I mean, it would get people to the town center, and then we would need out paths from that are regular. So I think we would have to not only looking at that, but also having as many out paths as we can into the subdivisions to help.
Okay. And then if we could pay CNAs and the staff that are in those support roles, and I say support with respect to nursing and the other duties, it is a full-time role within the home health care service community. If $20 were the pay range, would that address the supply issue? Do you think you'd see an increase in the recruitment pool, Beth?
I mean, I definitely think you would see an increase in the recruitment pool. I've followed other states who've gotten up to 15 to 18 and see that they are challenged, but not as challenged. But then on the flip side, I operationally have, well, what will that decrease the number of people that can access our services? And how do we work on that? But I will tell you, once we took our wage up this year and we started paying specialty bonuses for smaller cases, it has helped us with recruitment. Our biggest issue is worrying, what can the consumer pay?
So this has been terribly exciting. Jack, I am mindful of the time, and you did say very early on that things have ended on time, and I do not want to be the first to be associated with not ending on time. But it seems to me that there's some real quick takeaways that I'd like to, and Jack, I'll be in your ear on this, so I'd try to see how I can help. But public dialogue, there needs to be a real balancing of the awareness and equation and knowledge of what it takes to not only provide care, but also then to the cost of care. The issue of engaging a holistic response that engages community resources, and then that pipeline education training that hopefully would foster different levels of compensation, I think will be very important. I think within the North Fulton community network that we've got a lot to chew on there, and perhaps with the commitment of these two organizations here today, there is a way to begin this conversation in our region and perhaps reach beyond. Jack, thank you for the opportunity, and I'll turn it back to you to bring us home.
Dr. Ward-Robinson, thank you so much for agreeing to do this today and for promising to be in my ear. That means you're on the task force. You're back in. So I kid with people. It's a little bit like the mob. You really can't get out. Beth, thank you so much for sharing your wisdom. I'm always inspired by the way you try to tackle these problems with both facts and data, and that's something that's near and dear to our heart. I took a number of notes that hopefully we can see in the future, and some of the things that we do to try to broadcast our work. And that is our job, is to try to take these learnings from these fireside chats and the research we do to try to get the community to buy in. And Jon-Paul, you certainly have given us a lot to think about in fact, as you were talking, I made a note and sent it around to some of the folks on the call that maybe we should start. We've been struggling with, do we call it, we're pushing for affordable housing, workforce housing. Well, maybe we should just take advantage of the current environment and call it heroes housing.
Yes.
And
Yes.
see, I dare anybody to challenge that.
Yes.
It's not in their backyard. So
Yes.
thank you all for your time today. As I mentioned, if you want to be part of this effort, we're still meeting by Zoom. Just let us know. I will give you fair warning. The fact that you are here today means you are now on our email list. You can always unsubscribe, but we hope you will be helping us in the future with some of our challenges. The next Fireside Chat, pardon me, is April 21st, and it's going to be dealing with the same topic, but looking at the hospitality industry, who also are having great challenges. So thank you all for coming today, and have a great and as dry a day as you can.